In today's episode, we're breaking down the real reasons why ovulation might not be happening or happening irregularly and what that means for your fertility journey. You'll learn the top causes of ovulation disorders, how to spot the signs your body is giving you, and actionable steps you can take to restore ovulation naturally. If you've ever been told you're not ovulating or your progesterone or egg quality is low, this episode is for you. Welcome to the Finally Get Pregnant Naturally podcast, the podcast helping women identify the real reasons you haven't conceived or stayed pregnant so you and your partner can finally grow the family of your dreams. I'm your host, Dr. Katie Wood. Let's dive in, shall we? Welcome back to the Finally Get Pregnant Naturally podcast. Today we're talking about a topic that affects 1 in 4 women who struggle with fertility and often gets dismissed or misunderstood by both patients and providers. And that topic is ovulation disorders. So if your cycles are irregular, or your app says you're ovulating, but nothing is happening, or you've been told your progesterone is low, then this episode is for you. Let's dive in. So, what is an ovulation disorder? Ovulation disorders are conditions where ovulation is either irregular, absent altogether, or it's happening, but it's not producing a strong enough hormonal response for conception or implantation to happen. And this can sometimes be referenced to weak or suboptimal ovulation. So, why does this matter? Because without healthy, predictable ovulation, your body can't release a mature, healthy egg. And without an egg, there's nothing for sperm to fertilize. So, even if intercourse is perfectly timed, conception won't happen and can't happen if ovulation doesn't. And here's what's wild is many women are ovulating inconsistently or later in their cycle and they don't even know it. And it's because their periods are still showing up or they're solely relying on fertility tracking apps that don't account for their unique cycle. They're just estimations at best. So, how do you know if you have an ovulation disorder? Here are some signs that you could be dealing with one. So, cycles longer than 35 days or shorter than 21, having irregular or unpredictable periods, no noticeable shift in cervical mucus changes throughout your cycle, and temperature charts like basal body temperature that don't show a clear shift. And also, there's no LH surge on ovulation predictor kits or surges that can go up and down, mid-cycle spotting or very light periods, and low progesterone on blood work. So you may still be bleeding monthly, but that doesn't always mean that you've ovulated. This is called anovulatory bleeding, when your uterine lining is shedding but without first releasing an egg. So let's talk about why ovulation might not be happening consistently, and the root cause can vary dependent upon your situation, but here are the 5 most common ones that I see. So number 1 is PCOS or polycystic ovary syndrome, and this is one of the most common causes because with PCOS, you're experiencing hormonal imbalances, especially high androgens, and this can disrupt the development and release of an egg. And not all women with PCOS have cysts. Not all are overweight. Many can be lean and appear healthy on the outside. So PCOS can be commonly undiagnosed or misdiagnosed. And number 2 is hypothalamic amenorrhea. And this is often caused by chronic stress, overexercise, and undereating, or low body fat. Your body is sensing it's in survival mode and it shuts down ovulation to conserve resources. Even women who look healthy on the outside and probably lead what appear to be healthy lifestyles with exercise and eating healthy, they may be unknowingly suppressing ovulation due to high cortisol and calorie imbalance. And then number 3 is thyroid dysfunction. Both hypothyroidism and hyperthyroidism can throw off ovulation. The thyroid is your body's master regulator. So when it's off, even slightly, it can affect the entire hormonal cascade, needed for ovulation and implantation to happen. Number 4 is elevated prolactin. So, this hormone, often associated with breastfeeding, can be elevated even in a non nursing woman due to stress, pituitary imbalances, or certain medications. High prolactin suppresses ovulation, and that's why a lot of people view exclusive breastfeeding being a form of birth control, although that is not foolproof, I will add. And number 5 is premature ovarian insufficiency or diminished ovarian reserve. So, when your ovaries aren't responding to hormonal signals properly, either due to aging, autoimmune conditions, or environmental triggers, ovulation can become irregular or stop entirely. And this is not always about age, because I've seen women in their 20s, early 30s with signs of ovarian insufficiency, and women in their 40s who still ovulate consistently with the right support. So, what can you do about it? Here's the most important part. Ovulation disorders are not so black and white, and they're not life sentences. In many cases, they can be reversed or improved with the right root cause approach. So, if you're listening and thinking, I've been told my body doesn't ovulate on its own, I want you to know that that doesn't mean that it can't and never will again. So here's some steps you can take. Number 1, find your root cause. Run functional labs and tests to assess your sex hormones, thyroid, adrenal function, nutrient status. You want to test, don't guess. And I will die on this hill, but the tests and labs that your doctor is doing at your regular doctor, your OB, and your fertility specialist, they're not digging into this type of stuff. They're just doing surface level baseline testing to see what they can give you in terms of fertility treatment. Number 2, fuel your body. So, ovulation is a luxury that your body is providing when it feels safe and nourished. When your body is in a state of thriving and not surviving, then it feels safe to not only nourish you, but nourish creating life. So, prioritizing blood sugar balance, including healthy fats, quality proteins, minerals, and enough calories to support hormone production. Number 3, reduce stress and regulate the nervous system. So, this is huge, especially for women who are constantly on, or meaning you have a never ending to do list. You are always on the go doing something, whether it's for work, your social life, your family life. You can just never take a break. So, this is where breath work, nervous system support, and energetic tools can make all the difference. And I have seen this shift in my clients in just a couple of cycles. You can use herbal or supplemental support strategically for your specific situation and your unique root cause. And then get support, right? You don't have to do this alone. You don't have to figure this out alone. You don't have to do all the things that your doctor is saying you have to do if it doesn't feel right to you. If you have an inkling that something else is going on and you want to figure it out, working with a fertility practitioner who can track your ovulation beyond a generic app, can assess patterns in your chart, and interpret functional labs can save you time, energy, money, and heartache. So today we talked about ovulation disorders, what they are, why they matter, and the most common reasons they show up, like PCOS, thyroid issues, stress, low ovarian reserve. And we also covered how to start identifying the root cause and simple but powerful ways to support your body in restoring healthy ovulation. Because remember, ovulation isn't just about releasing an egg. It's an ultimate sign that your body feels safe, nourished, and in balance. So, if ovulation has been a mystery or a missing piece in your journey, I want you to know you're not alone. It's one of the most common blocks I see and one of the most empowering ones to address. Because when your body starts to ovulate regularly again, it's a sign that your whole system, is coming back into balance. And that's where conception happens, not just in the womb, but in the body that feels safe, supported, and seen. And you don't have to guess, you don't have to wait. This is something that we can absolutely work on together. So I just want to thank you so much for listening, and I will see you on this Thursday's episode where we'll unpack a common fertility saboteur that may be a big reason why you haven't conceived yet. I'll see you there.